Thanks, Jim, and Dee, thank you for the welcome to country. Jim did a good job, but I thought he was pretty happy you just arrived. To the Honourable Jillian Skinner, one of the election commitments that Jillian made was that we would conduct public forums in relation to health right around the state, in the country and also in the city. So Jillian, thank you for that. And to my parliamentary colleagues, terrific to see the great representation here in Western Sydney. I'd just like to acknowledge all our health leaders, particularly in terms of service delivery, which is what we're here to talk about tonight, but most importantly to the citizens and people of Western Sydney. I live in Moree, the northwestern New South Wales, fair way from here, and this morning I drove a couple of hundred kilometres to Inverell. We had the Farmer of the Year Mental Health Forum. The ambassador for that was, and is Nathan Hindmarsh. So I crossed tracks with Nathan, probably one of the favourite sons of Parramatta and his young son. And I said to him, well, mate, I'll be in Parramatta Town Hall tonight. He's having an evening in northwest New South Wales. Nathan's important in the role that he's playing and in relation to mental health, because as a new government, we wanted to make sure that mental health is everybody's business. And we need leading people, whether they be people like ourselves as politicians, but more importantly, community leaders in their everyday life, like Nathan, to step up and help us to take the lid off issues around mental health. So for him to play that role, I think is fundamentally important, and it's terrific that other people are stepping up in that area. As I said, we wanted to make mental health everybody's business. And as the first Minister for Mental Health, I'm proud to say that the O'Farrell and Stoner government has maintained that commitment and that people like Jillian and myself really are committed to making sure people get access to good care right across the state, no matter where they live, and that it is quality care. And one of the things that we've committed to was a reform of mental health, and reform driven by the community. And the two reforms I wanted to mention tonight, to start, is the Mental Health Commission as number one. What we wanted to do and are doing is to basically take mental health out of the political cycle, and that if we are to improve the network for mental health and access to mental health, whether it be by government service provision, acute, subacute or community mental health, or some of the non-government services, and I noticed some of them are here this evening, which is terrific, we need to pull in together, make it a lot tighter. People like Nathan are happy to have that conversation, because one of the frustrations that people have when it comes to mental health is access to services, to find out where best care is available. So we're committed to doing that, and the Commission's role is threefold, and that's to engage with the community under the leadership of John Fennelly, who's our new Commissioner, to look at best care models, both in and out of that hospital and acute system, particularly in the community side of things, to look at diversion for people with mental health that end up in incarceration because they are way overrepresented, and to look at the role of the Mental Health Tribunal to not just assist those people that are in involuntary care, but also for those people that are denied care, that they've got an appeal system as well. So that's an exciting challenge. That's a long-term view that we want to take. But certainly one of the main focuses that we'll have as a new government is to push back into the community and build those service delivery, not just programs, but to pretty much target the network. And to have the LHDs here this evening is quite exciting. The other area is the review of the Mental Health Act, and that was announced last week. The Act is there to protect people who come into contact with the mental health care system. It's to support the rights not just of the consumer, but also the carer as well. We want to broaden out that discussion. That discussion will start in the next month or two right around the state again, and I would encourage anybody interested in the mental health field to be involved in that discussion, because we want the policy and the legislative review to be driven by the community. We had over 2,000 people involved in the formation of the Mental Health Commission. Some of them are here tonight, and we want at least that, if not more, input from the community when it comes to the review of the Act and how we can improve services. So that's really it in a larger framework, but I just wanted to say, and Jillian knows this, being a country member, why it's great to have a coalition. I don't have a regional hospital in my area, it's 30% of the state. I don't have a base hospital in my area. We are very reliant in country areas on what happens in Western Sydney. You've got some of the lighthouse hospitals and best care, not just in this state or in this country, but some of it's worldwide practice, best practice. So in terms of the state contribution that Western Sydney makes, it's very, very important that we get access also to some of the services that we're continuing to grow here. So I would encourage you to think of yourselves as leading healthcare in and across the state, because that's what you're doing. There are always challenges, as Jillian said, but we are prepared to meet those challenges and to improve access and the quality of care for everybody in New South Wales. So people of Western Sydney, it's great to have the conversation. Have a good evening. Thank you.